on our updates to the Affordable Care Act through May. So a lot is going on. It seems like maybe there's not a lot going on, but actually, let's get into the presentation. So it's in preparation for the call today. I put our agenda together. Really, it's funny because since our last meeting where we talked about an insurance division decision on whether to delay implementation of the Affordable Care Act or not, a decision has been made just a few days after the last call. So we'll talk about that. Small group deductible limits, the out-of-pocket maxes for 2015, some high deductible health plan and HSA and FSA interesting components happening, as well as COBRA and the marketplace. So we'll jump in here to the call. And so starting with the Iowa Insurance Division decision on April 16th that carriers may extend or renew existing non-ACA compliant health insurance policies until October 1st of 2016. If you need that notice, there's the link. And by the way, these slides will be available on our agent portal, probably if not later today, for sure on Monday. So if you need to take a look at that decision, take a look, but that happened right after our last conference call last month. So as you know, what that means then is anybody that has a non-ACA compliant health plan, even though they may not be grandfathered, right? So these are non-grandfathered plans that are still with a non-ACA compliant plan. Individual and group will be able to keep what they have until October 1st of 2016. So that's obviously that's a big decision that came down, and one that I know can be sensitive depending on who you are. But I guess the way we look at it is, as long as we're the client's needs first, this decision may help some folks be able to hang on to the policies they have for another couple years, and hopefully we can get our arms around these rates. So the next thing that came down, and I don't know if you guys recall, but I think a few months ago I shared that I'd been out to Washington, D.C. along with the National Association of Health Underwriters, which thank you for all of you that are members. It's a fantastic organization. If you ever have an opportunity to go out to Washington, they do that once a year, and it's usually in the February timeframe. It was a fantastic opportunity to get in front of our representatives, and Health Underwriters helped in partnering with many of our legislators, senators, to get legislation in front of our elected officials to try to fix some of the things that were wrong with the Affordable Care Act. And this was one of them that they had teed up, so I was glad to see that it went through. That legislation is a hot link when you download this presentation, and it'll take you right to the bill. It came out of the House, and it'll take you right to it, that eliminates the annual deductible limits for all groups. I don't know about you, but I remember when this announcement came out, when we were learning about the Affordable Care Act, it was like, what? Why would they limit the deductibles in small groups, right? So that is awesome. It's effective now, like retroactively back to 2010. So I don't know, it's interesting. It's like, seriously, huh? And what does that really mean? They, most plans, again, if it was an ACA plan, the plans were all limited. But anyway, good news is the deductible limits have been removed, and I think that gives the carriers, I think, a little more flexibility. And of course, as you know, as we're trying to keep premiums down, if we can go with a little bit of a higher deductible plan, perhaps we can use some gap products to fill in. And anyway, so I think it's a really good thing. So just so you know, that did happen. And I'll read that bill. You can click there. And then these are some of the limitations, just to make sure that you're aware of this. As you know, the out-of-pocket maximums for 2014, and we've been talking about this for a long time, $60.50 for single and $12.7 for family. And so just knowing that these will be indexed, most likely every year. So know that they've already announced the 2015 out-of-pocket max limits at $6,600 single and $13,200 for a family. And the other thing, just like we were talking about with the insurance division decision, and that is that there's really no need to comply. They may keep their non-ACA plan until October 1st of 2016. So remember, that is for individuals, for groups. I hope most of you guys took our advice and contacted your existing clients, especially in the individual market, to let them know that there's an opportunity to shop. Would have happened during the open enrollment period. You should have done this. If you missed that opportunity, you're going to want to make sure you do that during this next open enrollment period. And remember, that's November 15th to February 15th. So we covered that last month. Those open enrollment dates got switched. And most of you guys in the senior market are appreciative of that, right? So anyway, this open enrollment for the individual under 65 market those dates have been changed. So, but just keep that in mind. Just make sure you let people know it's always a time to shop. And as you know, carriers will be coming out with their new plans this fall for 2015. And new plans mean new rates. So we still have yet to find out for sure if Wellmark's going to play in the exchange. They are leaning toward that way, but I think there's been no final decision. And I believe it's the June time where carriers need to file their plans and rates with the federal government to participate in the federally facilitated marketplace, of which we'll continue to have an FFM for another year. Our hope is that the state here in Iowa will decide to do something if 1/1 of 2016, which would be great. As you know, one of my big pet peeves is there's no broker portal on the federally facilitated marketplace, which limits your and our ability to help our clients. We can't see what they've been doing. They're on their own, and so we need to fix that. And I think, as I've shared in conversations past, Governor Branstad is supportive of agents involved in these transactions with the clients. So then the other piece that was interesting is, you know, I don't know about you, but I hear people asking me a lot, hey, our high deductible health is going away with Obama. And, you know, if we have anything to say about it, right, I think we do through our outreach to our representatives. The high deductible health plans are not going away, neither are the HSA accounts, and so the health savings accounts. So looking at what they're doing here in terms of indexing, once again, these plans, 2015, they have some minimums here. The annual deductible for 2015 then has been bumped up. In 2015, this year it's $1,250. It's been bumped up to $1,500. $2,500 for family, up to $2,600 for next year. So I thought it was just good that you kind of had these numbers handy. So when clients ask you the deductible levels, and then notice the out-of-pocket expenses. So this year they mirror, and this is like interesting to me. So I was putting this together. This year in 2014, notice that it's $6,350 and $12,700 annual out-of-pocket expenses for high deductible health plans. And notice for 2015, $6,450 and $12,900. And it's interesting because those numbers may or may not jive with the Affordable Care Act limits for ACA compliant plans. So we'll get to that in just a second. I want to talk to you now about contributions. So now you'll look at the annual limitation on HSA deductions for individual is $3,350 and family $6,650. So here's what, if you'll notice, the $3,350 in 2015 and $6,650, these are the amounts, the limitations on what they can deduct. So this has to do with what they can put into an account, right? And so, and then there's the catch-up provision is $1,000 for those eligible under at or older than 5 to be able to catch up, right, and put more money in. So it's $1,000. So anyway, so the HSA contribution, as well as deductible limits, out-of-pocket maximums, you'd like to think it's a mirror, and so we'll keep an eye on it. It should mirror what the ACA is saying. I think where it gets confusing is the deductible limits are going to differ, of course, and so there's a lot of numbers to keep track of. And then this one I found also interesting. As you guys know, too, we talk about HSAs and we talk about FSAs, and because of the Affordable Care Act, and if you recall, the Affordable Care Act limited the amount of money that an employee could put into an FSA. It was, I think I remember it as high as 5,000, and maybe it was even up to the employer to decide. But I think it was higher than what it is now. It's limited to $2,500. And so there was a memo that went out that the IRS was clarifying that they were allowing employers to allow employees to carry over up to $500 an FSA at the end of a plan year to use the following year. Well, that obviously is good to know, because I remember, talking about FSAs, and that's the whole use it or lose it concept. And when I would talk to clients about FSAs versus HSAs, obviously the HSA, a whole different ballgame, right? And there was none of that use it or lose it mentality. So what I found interesting here is then how does this impact my ability to either contribute or even have a qualified high deductible health plan with a health savings account? So you'll notice on the next slide here, there's another memo, and everywhere you'll see that different color there, there's a hyperlink. You can get the IRS memo if you want more detail. That this memo specifies that those who are covered by the FSAs, they're not eligible to make HSA contributions during that plan year of the health FSA, even if they have the carryover, and especially if they have a carryover from the year prior. So just know that if somebody's got an FSA and they're moving to an HSA, if they're taking advantage of that carryover into the next year, and maybe they're moving from a non-qualified high-deductible health plan to now a qualified high-deductible health plan, there's going to be some issues here if they take that carryover money and then want to contribute to their HSA. So just know that there's some other, and this is a great thing, if you guys haven't developed partnerships with accountants, I've found, especially when you start getting into tax treatment in some of these accounts, to find that local CPA or tax preparer in your market and partner with them, because there's so much going on, not only with HSAs and FSAs and HRAs, but also with the small business tax credit, with just how taxes are treating health insurance premiums, depending on whether it's individual, whether it's on a group platform, and what type of business you are. So then another piece, and you probably saw a lot of this come through. We pushed out a lot of this in our HR newsletters that we send to you guys through the KHI HR Solutions that we have. We pushed this out. I know it came from Nikia most recently, and a separate email really about model language for COBRA notification. Now, many of you probably said this doesn't apply to my small group or individual people, and so you didn't really bother to look at it. But here's what's really important to know: that if you guys recall, this is, I'll bet it was a year ago that we were talking about, people buying through the marketplace. And when you buy through the marketplace, if you have other coverage offered to you, and we're talking employer coverage, you can't get a subsidy. Well, then people said, well, no. When you go on COBRA, you can get a subsidy through the marketplace. And everybody thought, yeah, that makes sense, because you're not getting any assistance, right? If it's COBRA, employer is not contributing. And in general, right? In general, they're not contributing in most cases. And so then we thought, well, it's okay. Well, then all of a sudden we get into the marketplace and start, helping people. And it asked, do you have COBRA? And the answer was yes, you're not eligible for coverage. And I don't know about you, but there were a lot of frustrated folks out there, because the COBRA, as we know, was a lot more expensive, and they're looking to try to get, especially if they're unemployed, if they're leaving or they're retiring or whatever, they would qualify for a subsidy. So this clarifies it, updated language to make it clear to workers that if they're eligible for COBRA, and they leave a job, they may also choose to purchase coverage through the marketplace and get assistance. So, this coverage is important. I saw an email back from one of our agent's clients saying, "Hey, I'm under 20 lives. Why do I care about this notification?" No, you don't really, if you're not offering COBRA, because you're not big enough. But it's true for just being able to counsel employees that are leaving. You still have the Iowa continuation, so they can still continue on your group plan or get help marketplace and get financial help. So it just says, it says you can have more affordable options through the marketplace where workers and families may be eligible for financial assistance that would not otherwise be available for COBRA continuation. So I just wanted to clarify that because I think we were like, oh, yes, you can. Oh, no, you can't. Oh, and now it's, oh, yes, you can. So final clarification on that. And now we just had our meeting yesterday with Cooperativity Leadership. For those of you that are on the call that that work with us on your cooperativity, all of the GAs, all of the wholesalers have been affected by this issue. The issue is this. The federal government, because we're dealing with, and Cooperativity is dealing with, a federally facilitated marketplace, there's issues in the reporting that's getting. Now, I have not heard of issues with Country. I personally have not. If you guys are having them with commissions, let us know. For some reason, there were issues with reporting from the FFM to Cooperativity and assigning the agents of record. And wow, our meeting yesterday, though went fine, we were quite concerned and quite stern and shared our concerns. We know as a wholesaler that you never mess with an agent's commission. When an agent is due commission, you pay it. And this is just has to be #1 priority. And you know, above everything else, and we know everything else is important, the tracking and product information and brochures. I mean, there's a lot of other important, but in my eyes, commission to you is #1. And when this doesn't go right, we've got issues. And so now Cooperativity has credibility issues, KHI has credibility issues, and I just want you guys to know that this is top concern for us. We were on the phone, we escalated, and then we through the channels, because actually, as you recall, their partner that's handling all of their customer service, claims, commissions, billing, collections, all of that is being done by Health Partners in Minnesota. So Misty and I were on the phone with folks up in Minnesota trying to get resolution to figure out what the problem was and get these things fixed. So please know that, and many of you are impacted, please know that we're on top of it, we're working it, we're going to make it right. Just know that. So if you got Cooperativity commissions, and I'm telling you guys, it was in particular the FFM business you wrote. So if you wrote a lot of policies on the marketplace, that's what's in jeopardy here. That's what's not been reported properly. They do have 2 areas where an agent, so an agent could have been on that at the beginning, and then there's another place that an agent's name and NPN and ID number, et cetera, could have been entered. Somehow something got mixed up there. As you know, in addition, Cooperativity is trying to be flexible with by saying, hey, by the way, here's a separate form. If it was your agent, your client rather, and you're the agent and you helped them and your name didn't get on there, you didn't see it on your first commission run, then fill out this form and get it to us. So they've got even another process that they're trying to integrate with this reporting from the federal government to make sure they're paying the right agent. And so what we know now is it just didn't work. It's not working. So they know it's critical. They've heard it from all of the wholesalers, as I said. It's happened primarily on the FFM business. And if you haven't been in touch with us and you have a list of your clients that you look on your commission statement and they're not there, and you may even have some clients on your commission run that you have no idea who they are. I was talking to one agent. I was hopeful that maybe these are clients that wrote your name in. I was thinking that initially when we didn't know that there was a bigger issue here at Cooperativity. So of course we're talking now about chargebacks. Of course we are, because if there's clients that are assigned to the wrong agent, we want to get that. Cooperativity needs to get that fixed. So again, we're going to be working diligently and very closely with them. Know that we've put Misty and we've got another staff that we put on this situation to be whatever resource that we can through Cooperativity to get it fixed. So again, if you don't even know that you're impacted yet or not sure, look at your commission run that just came out within the last week. Look at your statements. Get a list of those clients to Misty, and all we need is the client name and some kind of identifier. You don't need to give us everything. Just whether it's a date of birth or a SOCH, get us something that would be able to identify that client for us in the list of all the clients that they have. One of the other things that we talked about with Co-Opportunity is also tracking. And I need you guys to know, again, this is an issue that's universal to all of the wholesalers with Co-Opportunity, that they're struggling with how to track FS business and get it to us so we can see it electronically. They are working it. They realize that if I can't see it, I can't be helpful to you. And if you can't see it, you're trying to call me, and I can't see it. And a lot of this, you guys, I have to tell you, this isn't necessarily Co-Opportunity's fault. This goes back to, I guess if I had to lay blame, it has to do with not having a broker portal in the FFM, because we have no way to go in there and manage our accounts. We don't have an access to log in with my NPN and show all of my customers that I have helped. And so I mentioned that early on in the conference call this morning. That's probably my biggest point of frustration and pain for you guys and for us, because we can't help you when you call in. You want to know, what's the status of that client's policy? What we have to do is we have to call into the carrier to find out, because we can't see it. Anyway, so just know, I know you hear it in my voice, the frustration, and know that we're working on it, and continue to give us your feedback. That's what we need, because the minute that the statements went out and we started getting phone calls from agents going, what the heck? We then took that immediately to Co-Opportunity, because they didn't know until we notified them. So our feedback, yours to us and us to them, is so critical. And they'll work this out, and this is one of those things that happens when you're new and when this is a new process. And so I'll leave it at that, and I'm sure feel free to email me any more of your frustration or call me, that's fine. But just know that we're handling it, and get those lists directly to Misty. Don't send them to me, because I'm just going to turn around and send them to Misty. And if you're using the PHI, you really want to encrypt it. So hopefully you've got that. If you don't have encryption software, then you need to just send Misty a message. She'll send you an encrypted message, and you can reply back to it and attach the client list, okay? Because you can't be identifying information, obviously, on a client without encrypting it. So, again, if you need help with that, just get a hold of Misty. Just shoot her an email, and help you with that. As you know, one of our commitments to you is to offer you continuing ed credits. We'd like to think that they're of value as well. Some people just show up because they need the CECs and they don't really care what the content is. We'd like to think that we're going to give you some really good content, and we're going to give you some continuing ed credits as well. So if it hasn't gone out yet, it should be going out like momentarily, and this should have been out probably a week ago, but we just met with our folks who said, hey, why don't we do some continuing ed? And we said, okay. So for those of you that need it and are interested, we're going to be doing it in 2 locations right now, and then certainly we're open to your feedback. If these go well, we can certainly bring it to other places across the state, and give us your suggestions there too. That would come to me. Let me know other cities that you'd like to see this happen in, and we could consider that in the future. But I don't know. It's into the summer, and we don't know how popular this is going to be for folks. Kids are out of school, most of them, I believe, by June 3rd and 4th. And maybe you're starting vacations, and schedules get crazy in the summer. So we're going to try this. You'll notice that we're going to make it really flexible. So if you only need 3 CECs and you really need that, you can come in the morning session. So from 9 to noon, Wellmark is going to present on some health reform updates for a couple of CECs, and then they'll do an ethics. So you'll get that one ethics if you need that here. And so that's in the morning session. And so we'll have a light breakfast and then that session. And then if you want to come for the afternoon, then we'll have the lunch we provided. So come a little bit early, and then we'll go from 1 to 4, and you'll get another CEC. If you want to spend the whole day with us, that's fine too. Just know that the afternoon session will be more around, and this is Dietrich Drenko from Advantage Administrators will be presenting our afternoon CECs, and also helping us to host lunch, guys. So I told him, put together CEC's worth of good stuff around private exchanges, self-funded plans. Also, some of these are known as stable funding plans, but they're bringing that down to, 10 lives. I mean, this is crazy, but you get that really healthy small group that's saying why, and maybe they're even got an older demographic, right, but really healthy. Why am I paying these higher rates? For maternity coverage, for all this stuff, and all these really high loaded rates. If you want to put a self-funded plan together down for small cases, that's what we're going to be talking about, as well as the whole HSA, HRA, and MSA administration, some different enrollment platforms available, and some really good stuff. So that's what the afternoon will be. If you want to join us, either Fort Dodge or Des Moines, that's where we're going to be at, and that email should be going out shortly, and you can RSVP. Also want to let you know about our Agent Appreciation Golf Outing. So you'll be getting an invitation to this as well. This is for all of our agents to come enjoy. We're co-hosting it with Wellmark. And so we'll do a 10 o'clock shotgun on Wednesday, June 25th. If you join us, we'd love to have you. We have a lot of fun, build relationships and some camaraderie, and we'll be getting that invitation out here soon as well. And I know summer schedules are filling up, so I think what I'd like to do is open it up now to any questions that you might have, and hopefully you're figuring out, if you don't have microphone on your connection, then you can do a chat. That's a little, look on your little menu there and open that up and chat to me. You can also raise your hand if you have a microphone, and then I'll unmute your microphone so you can ask a question. I'm going to go out here to our attendees and just check to see, while you're navigating your little screen there, see if there's any questions. Or comments, by the way. If you want to make a comment, that's fine too. While I'm waiting to see if anybody's got a question, raise a hand or issue a chat. I wanted to comment that, we had asked carriers, specifically Wellmark Opportunity, what can you do to help us with this concern or problem that we might have with all these renewals, especially on the group, but also on the individual side at the end of this year. We think about it's in all three of the key markets, which is the individual market under 65, the over 65 market, and the small group market. We're going to be just nailed, right, starting October 1. In fact, we've kind of mentioned our KHI staff, no week-long vacations after October 1st. If it's a day here or there, if you have a child that needs to, go to the doctor or something, that's fine, but no week-long vacations after October 1st, really through the end of the year, and probably even almost through, February, but especially through the end of the year is what we've specified because of what's happening here. So the carriers are saying, Lynn, Brenda, Andy, our hands are tied because we have to send rates in, especially when you talk about exchange business and ACA plans. All of that goes to the division in about the time frame, gets approval back, sometime probably July or August, and then they start rolling these things out. So we're going to be right on top of it. And in addition to that, as you guys know, Wellmark is going through this whole, wholesale distribution, relook at the contracts. And so that's all going to be happening this summer. So, we'll continue to talk with you as we learn more, but the idea of trying to not get hit so hard at the end of the year, the only thing we're going to be able to do now, everybody, is just look at what the rates are now. If you haven't shopped it with them since last December, relook at it again. Maybe their demographics have changed, but looking at maybe some different plans, looking at maybe self-funded plans, looking at some defined contribution plans, maybe in the rush of trying to get everybody locked in, you weren't maybe as thorough as you could have been. So it's starting now to look at those plans and determining with what we have to choose right now, does it make sense to move them now into a June, well, it's a little late for June now, or getting close to being late for June, but go. July 1, August 1, September 1, starting to move some of those off of the 12-1 or 1-1. So I tell you that the carrier's hands are somewhat tied, and we've asked, get us rates any sooner. So we'll keep asking and let you know as soon as we hear something. I would love for somebody just to raise your hand and make a comment this morning. I don't have, you guys are awful quiet. Not seeing any chat questions typed. Well, I hope you guys are finding these helpful. You know, we plan on the feedback we've gotten is you know, you guys want us to keep doing this every month. So maybe it's just fine that we only go for a half an hour. Then, if this is all the information that I have to date, so on the updates. So I'm just scanning the audience again just to see if we have any more hands raised. And I'm not seeing any, and I don't see any chat. So this session, by the way, is being recorded. And we do that every month, so should you ever miss one of our monthly calls, you can catch those on khiagents.com under, I believe it's the tab is videos. We're doing, by the way, just some cleaning up of our website, making it easier to navigate and a little more streamlined. So hopefully it'll make sense to go out to khiagents.com and find the information that you're looking for. It'll make a lot more sense to you. So one more look-see here before I wish you guys a happy weekend. Let's see if there's anybody with a raised hand. And I'm not seeing anybody, and I don't see anybody with a chat question. So what I would say to you guys is have a wonderful day and a wonderful weekend. And thanks again for all your business and support. And if you have any questions at all, don't hesitate to contact one of our team members. Or you're always welcome to give me a call. And take care. We'll see you again soon. Bye-bye.